These days, computers store a lot of information about us, whether we're buying something, having a social care assessment, or visiting the doctor. Computer systems help organisations to manage important information about us. Now, imagine if we could use data to improve health and social care. By securely sharing information, professionals can make better decisions, avoid duplication, and reduce mistakes. But there's a problem. Different computer systems record data in different ways, which makes it hard to share the data between them. To fix this, we need a common way of recording data, a data standard. If we all describe data the same way, it flows smoothly between systems. This makes sure that when information is shared, it can be understood and used more easily. Creating data standards isn't easy. It takes time, teamwork, and compromise. Everyone across health and social care must agree on what the standard should be. In Wales, we're using Fast Healthcare Interoperability Resource, known as FHIR. Unlike past attempts to standardise data, FHIR doesn't force everyone to work in the same way. It works around small differences in how people work and focuses on the data that needs to be shared, making collaboration easier. Better data means better decisions, fewer mistakes, and better care for everyone. To find out more information about data standards and FHIR, visit our website insightscollective.socialcare.wales/data.